Good morning. Welcome to the Doctor's Inn. Ask Dr. Arwady. It's Thursday, November 5th.
It is.
I'm so happy to be here with you and with Dr. Arwady. I'm Sybil Madison, your Deputy Mayor for Education and Human Services. And this is Allison Arwady, your Commissioner for the Chicago Department of Public Health. This is where you can get your questions answered about COVID-19 in Chicago. We're going to check our distance. It's so important that we are appropriately distanced from each other. And then I'm just going to turn it over to you, Dr. Arwady, to share with us today's data.
All right, so let's dive right in. Chicago.gov/coronavirus. That's your one-stop shop for all things related to coronavirus in Chicago. We've had more than 4.5 million visitors to that website. A lot of people are using it. And the data dashboard itself, which you can get to right up at the top there under latest data, or you can get there directly through chi.gov/COVID-dash. We're pushing 1 million visitors to the dashboard, actually. So I know a lot of you are looking at this. I look at it a lot. We actually use the same dashboard that we make available to the public for some of our own decision making. So here's where we are, and the news is not good. So on the homepage, if we pull it up here, first of all, you will see that our current positivity rate is at 10.9%. It's up almost a percentage point just since yesterday. If you remember, we want to be below 5% here, and we were below 5% like a month ago. And then have just seen this going up really significantly. That's especially concerning because compared with the next number down, where we see we are breaking records on testing. We're now testing an average of more than 14,000 people a day here. We're also going to cross 1.5 million tests done in the city of Chicago today. And that has been good that we've been building testing capacity every day, testing more people. But even in the context of testing many more people, that percent positivity is going up and not down, which tells you that we're not keeping up with the outbreak in terms of testing. So both of those very concerning. And then our case number overall. We've had more than 108,000 people now diagnosed with COVID in Chicago, and our daily case average is at 1,395 cases per day. That is up almost 50% from a week ago. And a reminder there, where do we want to be on that? Ideally less than 200. And we were there earlier in the summer and then managed to, while a lot of the country was surging in that second surge, we kept it in this 200 to 400 range. And then really since October have seen it take off, and it is rising really quickly. Let's look at the daily by demographic here just to get a sense of that. So look at this graph here up on the right, and I'll blow it up so you can see it. This is our daily case rate graph, and as you can see, how sharply that is going up, unfortunately, just as steeply or even steeper than it was during some parts of our first outbreak. And we're now seeing more cases of COVID diagnosed every day than we have ever seen before in Chicago, including in the first wave. And unfortunately, the same thing is true in Illinois and in the US. Obviously, the main attention over these last couple of days has been on the election, but yesterday was the first day that the United States had more than 100,000 people diagnosed with COVID-19 in a single day.
Yeah. Not a record that we
want to break. There's 23 states that have broken their records in this last week in terms of number of cases, and all over the country, unfortunately, this is really surging. Let's also just quickly take a look at the weekly dashboard here. For those who've been following, we do have our dashboard now updated. It was under construction for a few days there. This is because we were pulling in the test positivity so that we were comparing using the same numbers that the state is using around mitigations. As a reminder, that 8% positivity marked the level at which the indoor restaurants, for example, were closed. The tier 1 restrictions, exactly. And it is that number that the state is really using and that we're following around additional restrictions that may come into place. And so we wanted to really make sure that at the geographic level we could see where we were. So look, if we take a look at right now, this is defaulting to the most recent week, just counts of cases. You can see in the Southwest here, 60629, we're having the most cases diagnosed, 660 in the latest week. But also, if we look at positivity here, and we flip, you can see also the darkest here, again, really in the Southwest, and this zip code 60632 at a 21.6% positivity. So the city overall is about 10%, and we've got parts of the city that are more than twice that. And still continuing to see a lot on the Southwest side, really followed by the Northwest side, what we've been seeing pretty consistently here. You can see 60639 is up to 19.8% as well. And you can continue to explore this. You can look at the cases, tests, deaths, but the bottom line is that things are not heading the way that we want them to, except on testing, where we are growing capacity, but need to be growing it even more so.
Yep. Testing, I think it underlines the fact that, testing tells us something, especially when positivity is going up, but testing is not the answer.
No, exactly. And this is, I can't emphasize, thank you for bringing that up, because I can't emphasize it enough. I think people are really counting on testing to be the thing that, quote, gets us out of this. And that White House outbreak, if nothing else, I hope it really illustrated to people that the highest level of testing does not protect you from COVID. Yeah. You need to be doing the masking, you need to be doing the social distancing. All testing does is diagnose the COVID when it's already there. And remember, you can have COVID. If I got COVID yesterday, any test I did today would be negative, because it takes some time for it to show up. And unfortunately, people can spread COVID. The 2 days prior to when your symptoms start are some of the most infectious time, the time you're most likely to be spreading COVID, which is why everybody wearing the masks, doing the distancing, paired with, of course, if you're sick, you need to be staying home and getting the testing, et cetera. So it's a lot of the same messaging, but it's doubly important. You know what? I'm going to just add one other comment on this.
Go ahead.
I woke up very early this morning because, like a lot of people, I'm watching the election and worried about COVID, and it's daylight savings. And normally I jump right into my email, or I'm trying to catch up with stuff. But this morning I was like, I'm going to sit down and do some literature reading on COVID, because this is something I actually find very relaxing, ironically. It's like there's such a lot of work that's being done in so many settings, and it's really helpful to see, what's happening in diagnostics, what's happening in the basic science, what's happening in the epidemiology, because
of course your reading for pleasure is scientific journals.
I know. Well, I do other reading for pleasure, but the point is, I find it really interesting. But the journal article I read that just was the most, it really struck me the most this morning, was one out of the UK, actually. And it was a study, it was by somebody called Wright, W-R-I-G-H-T is the lead author, and it was called basically What Predicts Adherence to COVID-19, guidance, right? And they looked over time, they talked to more than 51,000 people who live in the United Kingdom. And they asked them a lot of questions about COVID knowledge, about their mental health, their well-being, their social experiences, potential barriers, how much confidence did they have in institutions, how much time were they doing specific activities. Really, it's been this big picture of social isolation, all the ways in which COVID is impacting people's lives. And then they asked them, how likely are they to be wearing masks, social distancing, washing hands, doing the things that we know keep us safe. And there was only one thing that stood out as actually predicting people would be likely to adhere to these guidances. And it wasn't some of the things that I might have thought, like COVID knowledge, and it wasn't, how is my own mental health and well-being? It wasn't my social experience. It was trust in government. And really recognizing that when people had increased confidence in the ability of the government to handle the pandemic, that was what was actually related in the UK to sort of higher compliance and adherence to the guidelines that help keep us safe. And it wasn't a lot of these other things. And I'll tell you, regardless of how this election turns out, I feel so strongly about the need for us to just make sure we are on the same page about messaging and about recognizing that things that help keep us safe are not a political fight.
Right.
And I'm worried because I think regardless of the outcome, this has not been a unifying week in any way, I think, for the U.S. And of course, here in Chicago, I see our role first and foremost of getting the right information out there, right? Mm-hmm. What is happening in Chicago? What are we doing here to try to protect about it? What evidence do we have about how to keep people safe? But I'm worried because as people, I think, are increasingly reading misinformation or less likely to trust the science, the guidance, we are going to have increasing trouble controlling COVID. And we had a conversation yesterday with Argonne, with the modelers who have been helping a lot as we think about, what do we need to do to bend the curve, right? We did this once before. We bent the curve, but it was in the context of a complete shutdown.
Right.
And for a lot of reasons, we're wanting to, we want to get Chicago through this as well as we possibly can. Physical health, of course, limiting deaths, hospitalizations, et cetera, mental health, but also where we can, sort of economic health and thinking about these things together. And the thing we need to do, it's not rocket science.
It's very simple.
We need to have people change their behavior so that the protective measures that we're all putting in place as a city, we need those level of protective measures to go up about 25 to 50%. Meaning like 1/4 of us need to sort of do all the way, and so for me, it's this idea, and like if we could do that, we would bend the curve. And so for me, and I hope for you, it's about recognizing. I've really just personally been trying to think about what can I do to limit my risk, because when I limit my risk, I'm helping make up for maybe people in Chicago who perhaps are not limiting their risk as much as well. Like everybody needs to do their part here. But where there are things that we can do to help limit that spread, and literally that just means 25% more mask wearing, 25% more social distancing, 25%, more of these things. And, the recommendations around not having people into your home who don't live there, those are based on data. Those are based on what we are seeing here in Chicago. But I know people are broadly not necessarily thinking it applies to them.
Yeah.
So I'm a little worried when I read this, that at the end of the day, success here is about the individual decisions that people make. It's no different than it has been.
Yeah. And it's like really 3 simple things.
It's been the same things for many months. Yeah. So.
Okay, 25% more people, or 25% more of the time, or 25?
We need a 25% reduction in sort of that risk, reduction in transmission. And so I think at an individual level, that's like, how do I step up my ground game at least 25 to 50%? And, this is a citywide kind of calculation. And so if there are additional ways I can dial back, I can sort of help with others.
And it's interesting because, we hit the 8%. So the state came in and said, okay, we're going to kind of make you change your behavior.
Well, because it's shooting up like this, exactly.
And so some of this is, what I'm hearing you say is now we need to tell ourselves, I need to change my behavior.
I know.
And look at what I'm doing. And what more could I do? How could I double down?
Yeah, that's right. And I really, people are tired of this, I know. And people are wanting things to, quote, be back to normal. I get asked this, I don't know how many times a week.
How long are we going to be in
How long? When do I get to go back to normal, et cetera? And, certainly I am feeling relatively confident about the ongoing progression with vaccines, but even that is not going to be when a vaccine is available. It's going to be many months to sort of roll this out. And we need to be bending this curve. We've got a doubling time of about 12 days right now. With the number of cases that we have, we'd have hundreds of thousands of cases just by the end of the year if we're not able to, to turn that around with increases in hospitalizations, with increases in deaths that come along with that. And it is avoidable. Like, it absolutely is.
Yeah.
So
we can control this.
We can.
All right. Let's get
off my soapbox for a second, but
let's turn to let's turn to you. And your questions. All right. This is from Kevin Lamana from Facebook. Hi, Dr. Arwady. thank you for your consistent transparency. Can you please shine some light on the vaccine rollout plan once available?
Yeah, sure. So we've been doing a lot of work at CDPH on vaccine planning. Actually, way back at the beginning of all this, back in March and April, you might remember we had very large stockpiles of personal protective equipment here that we had built up over years and years.
Yes.
And so we were doing some scrambling in that space where there were some things we didn't necessarily have, but by and large, we didn't need to buy any N95s, for example. Instead, we did a lot of purchasing of syringes and the things you need for vaccine, and really made sure we were shoring up like the equipment and the logistics around what we knew would eventually be a vaccine campaign, even months ago. We've spent the last few months, for example, as we've been following the different, there's a number of different vaccine candidates, as we've talked about. The two that are furthest along at this point both require what's called ultra cold storage, meaning they have to be at like -70.
Wow.
And so this isn't just frozen.
There are a lot of implications.
A lot of implications. And so we've spent sort of over the summer months, we didn't have that kind of ultra cold storage capacity here. Very few places would. I think we did a survey, and there's only 3 or 4 of our very largest hospitals that have any of that ultra cold storage. So we've been building up the capacity to be able to hold, 100,000 plus doses of this at a time. But then we've been working also, there's a lot of logistics around when it comes, sort of, how do you prioritize that? Where does it go? With all of these logistics of, some of the early, we don't know yet which are going to get approved. Some, it's a 2-dose vaccine that is 21 days apart. Some is a 2-dose vaccine that is 28 days apart.
Wow.
Some of the ones further back are a 1-dose vaccine. Some of the other ones further back don't require this ultra cold. So we're needing to do like a lot of planning for different scenarios. And we've already started pulling our healthcare partners together. Really every week we've got people already registering so that we have some understanding of the ability to spread. So I'll talk a little bit of details of that.
Yeah.
So we don't know for sure when COVID vaccine is going to be here because the trials need to be finished. Oh, and slight aside, I learned that Dr. Peter Marks is his name. He's the lead at the FDA on sort of the biologic safety piece. He's basically the one in charge of safety at the FDA. I learned this is the same Dr. Peter Marks who taught me hematology and oncology when I was a resident, when I was a doctor in training at Yale. He was this like amazing, super detail-oriented clinician, okay? Like he was the doctor who would like come in at like 4 or 5 a.m., like before the interns and like, check on all his patients and like tons of detail and round a second time in the afternoon. Just a very, very good doctor, very detail-oriented, really knew his science. Well, he's now
this is
at
great,
the FDA.
right?
So this is like very reassuring to me. Like in terms of, like I actually personally know the person at the FDA who's in charge of this, and I completely, I trust him for years, well before COVID. So that was an aside, but I just learned this.
Yeah.
And so when a vaccine is finally approved, there will be a distribution process, I think, quite soon after that, because, again, we've been doing some manufacturing of these vaccines even while the trials have been ongoing, so that those that prove to be effective, they're sort of ready to go. We're not waiting another 6 months to start making them. And there's been some prioritization schemes that have been put out by the National Academies of Science and Medicine, for example, and actually leadership from here in Chicago. Dr. Helene Gale, who has a long history at the CDC, really one of the national experts, is now at the Chicago Community Trust. She was one of the leaders of the work group really at the national level with the National Academies around prioritization. She has a huge interest, as you may know, in health equity and really thinking about how are we making sure resources generally are getting where they need to go. So first, just a nice Chicago connection there in terms of the science. But the National Academies, and you can look online if you want to see what they look like, and maybe we could, in a future one, talk some more details. But there's a prioritization scheme which will get some additional input from the ACIP, the group at CDC that basically advises about immunization practices once there's a vaccine candidate and we see what the data looks like in different age groups, et cetera, et cetera. So this is still, there will be details that come,
working it out.
but at the highest level, the very first vaccines will be given to frontline healthcare workers, who, of course, are at the highest risk of acquiring COVID. Also very necessary to make sure we're protecting that population. We're doing work right now to enroll all of our long-term care facilities, our nursing homes. There will be a plan to sort of bring vaccine. We'll be working through pharmacies and others to bring vaccine into some of those settings. We'll be distributing vaccine sort of through hospitals, through others. There will be a kind of healthcare worker, first responder, really highest risk people first. And then we'll sort of be moving from there in terms of expanding out to people. And again, this depends a little bit on the vaccine, how it performs in different age groups, et cetera. Right. But there will be some prioritization related to the kinds of exposures that people have and the kind of risk factors that people have. So children will be quite a bit later, right? They've broadly not had severe outcomes from COVID, and we want to make sure that all the appropriate, testing and follow-up is sort of done there.
Do we know yet whether folks over a certain age would be prioritized?
Yeah, they would be, but the details of that, we'll wait to see what the exact vaccine kind of looks like. And I think different vaccines may end up having, slightly different profiles in terms of who they work for. So the point is, it's a little bit complicated, but there's a lot of work. It's a lot bit complicated. But we are very committed to being absolutely ready here in Chicago for whichever of these vaccines sort of goes the distance. And pairing, the other thing is we really want to pair, again, to this trust point, right? Like pulling together a lot of local experts, not just the health department, like doctors and researchers and people who are used to looking at data, to look at this FDA data, to look at this trial data. It will all be available, and we'll be talking sort of collectively, around, what is our advice around this? Like, do we think that this vaccine is good? And then pairing, assuming that this is looking good, we're saying, yes, Chicago's going to be recommending this, and then pairing that with sort of trusted voices in the community around, it's going to be a lot about talking really honestly and openly about what have these trials shown.
We want people to get vaccinated.
To get vaccinated, yeah. So, I am really excited about this. I obviously will be looking very closely at all of the vaccine trial data. I will be first in line to get a vaccine as long as I'm confident that the appropriate trials have been done. So.
All right. It's really exciting to see in the many different ways that Chicago has played a leadership role.
We're trying.
In all of this.
Right, and that's not the health department, but that's someone here in Chicago who is such an important national voice on equity issues and comes from this health background and is in philanthropy. Chicago Community Trust, pulling together so many of the philanthropic groups here in Chicago who have stepped up in all kinds of ways to support around COVID. This is really, it's been in so many ways, even though our numbers are on the rise again, I know that we can do this here, right? Because we've seen people at all levels, individuals, the community-based groups. We've seen churches and other religious organizations. We've seen, food banks. We've seen funders. We've seen government. Lots of work together to work on this. And we can do this, but we need people to sort of recognize that we can do this, and it is in your hands at the end of the day.
We can do this.
We can do hard things.
Each of us can do this. Yeah.
Yeah.
Okay. Patricia Parsons from Facebook. Perhaps this question is related to all the information we shared. How often should I get tested?
Okay. So there is not one answer to that question because it depends on what Patricia's risk factors are and symptoms are. So if you have symptoms of COVID, you need to get tested for COVID, first and foremost. That is the number one message. I don't want you thinking, oh, it's probably the flu, oh, it's probably a cold. First and foremost, if you've got symptoms, even mild symptoms, you need to be staying home except to be getting testing, basically, or medical care. But we want you to get tested. So if you have symptoms, that's first and foremost. Secondly, if you have an exposure to COVID, especially if you get contact traced, but even not, if you've had exposure to someone with COVID, you've been within 6 feet of them, for more than 15 minutes, even if it's been a little bit here and there, without masks on, you are at increased risk of having gotten COVID. You have to do the 14 days of quarantine regardless of a test result, okay? Let me just say that again. if I've been exposed to COVID, like a true exposure, I have to quarantine for 14 days, regardless of testing. And in that setting, I'm not going to get tested right away anyway, because my test will be negative if we were just exposed right now. I'm going to wait 5 to 9 days, get a test, but I still have to complete that 14 days of quarantine. Other than that, it depends a little bit what your other risk factors are and where you live. If you are in one of these zip codes that is really experiencing major surges of COVID, particularly if you are out and about, if you're an essential worker, you're going to church, you're having essential, hopefully you have pared back your activities to things that are essential, but there are people who are essential workers and are out and are doing things, that would be a setting where more testing is required. So I can't answer for every individual person. We have made sure, just to give you a sense of this, in long-term care facilities, we're testing everybody, staff, residents, like every week, right? Because we don't want to miss stuff. There's a lot of regular testing that's been set up in some of our highest risk settings, and we're continuing. Shelters, we're testing anybody who's coming into the jail, for example. Like, there's a lot of testing that's been going on, but there's not sort of a one-size-fits-all answer for that. But the bottom line is symptoms first and foremost, exposure secondly, meaning like a direct known exposure, and then thirdly, if you've got a lot of known risk factors for COVID, those are the recommendations.
And I hear you saying we should all be limiting our chances of exposure, right? And not use a test to say, oh, I'm good, so I'm going to keep living my best life.
That's what worries me. I think in a few months, how quickly has this testing landscape been evolving? I think it's likely a few months from now, within 6 months, probably you'll be able to go and pick up relatively inexpensive tests, at Walgreens and
do them at home,
a
pregnancy
test. I think that will come, but it's not here yet. And there's some issues with that, partly because we wouldn't have visibility into that, but also that my worry then is people will think I'm testing, I'm fine. Testing is a piece of this, but if I had to choose between a test and a mask, I would take a mask every time. So. Just in terms of like protecting myself.
Yes. Okay.
And everybody around me, more to the point.
It's a quote for the day.
Yeah.
Well, speaking of masks, Margaret Quinn from Facebook, do masks offer protection from the flu?
From the flu.
The flu.
Yeah.
Little curveball there.
Curveball. So they do. So as a reminder, when you are wearing your mask, you are first and foremost protecting those around you. You are keeping your germs inside. Now, that is true for any of these respiratory viruses. Flu is a droplet virus. Like, wearing a mask is extremely helpful in terms of, first and foremost, keeping my germs, like, inside me and not spreading them to others. Of course, if everybody's wearing them, you're all protecting each other. Some of the most interesting research that's been done is actually starting to understand that there probably is some level of self-protection even with the cloth masks, because at least droplets, there's some protection there. But also, this hasn't been proven yet, but there's been some interesting studies suggesting that where people are wearing masks, the amount of virus that you might get in, even if you're getting infected, is less. There's some people theorizing that may be why we're not seeing as many serious infections. None of this is proven yet. These are just theories. But for the flu, absolutely. Like, the Southern Hemisphere, which had its flu season, right? They have it in the opposite time of year from us. So they had their flu season in sort of the peak of like stay at home, social distance, mask, being very serious about COVID. They had almost no flu season.
Wow.
And they vaccinated well too. Yeah. So here, if we can vaccinate, please get your flu shot if you have not. And we can wear the masks. It will also be, and we hand wash. All of these things help with all of the respiratory viruses, not just COVID.
Okay. Rico Johnson from Facebook. Wouldn't a 100% positivity rate be the number you want? Wouldn't that mean that every person tested is indeed sick with COVID? Wouldn't that mean that we aren't wasting tests on people that don't have COVID?
Oh, what a clever question.
All right, Rico.
So here's the thing. There are a lot of people. The biggest problem with controlling COVID of the entire outbreak is that people have COVID and spread COVID very, very well before they have symptoms, and there are people who don't have symptoms at all. If this were a disease that 100% of the people got symptoms, this would be a lot easier to control. That's how Ebola is.
Yeah.
So we could.
And it's interesting because this is something that we learned over time,
Yes,
right?
we
Because at the
did.
beginning,
Right.
we did not know this.
We didn't. It's very it's unusual for a virus to have a significant period. This is like, if you were gonna, like, the COVID-19 virus has been a very successful virus, largely because of this. It's managed to learn how to spread before it can really be detected, and it's lethal, much more lethal than flu, but not so lethal that it kills people very quickly. And so, Ebola, half the people who get Ebola die from Ebola. And so you don't have this spreading of people with sort of mild illness out and about or who don't know it, and it has the chance to really spread. It's a very different disease. It's part of why the contact tracing has also not been the silver bullet that people were hoping for, because it's been really tricky. So the thing with this is that, 100% positivity would say I'm using my test very efficiently, but it would tell me that I'm missing a whole lot of people who have COVID. And if you look back early in the outbreak, we didn't have a lot of testing capability. Our percent positivity was like 30% because we were only testing the people who were sickest, right? We were testing people who were in the hospital. We didn't even know about asymptomatic spread at the beginning.
Right.
So you saw a high positivity rate. So that was sort of more efficient testing. But for a virus that can spread in the absence of symptoms, this is the problem. You need to have sort of more widespread, including people who have not yet developed symptoms. And so here we want the positivity to be low. One more thing.
Yeah.
We set sort of as a minimum goal here, if you remember, a million months and months ago, we said we need to be doing at least 4,500 tests here in Chicago.
We wanted to be testing 5% of the population, right?
5% of the population a month. If everything is controlled very well, even just for sort of surveillance, keeping an eye on things, we want to be testing at least 5% of the population a month. But as the percent positivity rises, you work to bring more testing, because as it's going up, even as testing is going up, what you know is there are more and more and more people who are also asymptomatic and out there, because we're not testing everybody, right? We're probably diagnosing between probably about 20%, we think, of the people who probably have COVID. We estimate across the country it's between 5 and 10 times as much. We have pretty good testing access here, so it's probably in the 5 to 7 times range, and we've looked at our death rates and looked at some other things for those estimates. But I sort of love the concept, but for a disease like this, unfortunately, we have to do a lot more testing, and when we have a high positivity, it actually tells us that there's even more COVID in that environment than we're detecting.
Yeah. Okay. And I was going to say, when we were at that 30% positivity, we didn't have community-based testing the way that we have it now.
That's right. Exactly. Exactly. And that's one of the things, between the first peak and sort of the current peak, the first peak was a very different sort of testing environment. We also didn't understand as much about a lot of things related to COVID. And so although that peak looks lower, many of those people were much sicker with COVID.
Yes.
And so for example, for the hospitalizations, we've seen a doubling of people hospitalized more than a doubling over the last month. That's really concerning. We've gone from fewer than 250 people hospitalized to, our average is now over 500 people across all the Chicago hospitals who have COVID, either diagnosed or we're waiting on a test. But that is we had about 1,200 people hospitalized in the non-ICU at the peak. So this is sort of the difference in terms of where we are. Yeah. But the concern is the slope for me, not the number. That's why I'm not as worried. I mean, I'm worried about it, of course, because every case of COVID means more opportunity for spread. But the slope of increase comes against the testing that was there in place before it. And so the rate of increase in that first peak tells you in the testing environment that you have there, how quickly are things increasing. In our testing environment that we have here, how fast are things increasing? And unfortunately, the rate of increase there is really similar. And so I know it can be a little confusing for folks, but it's sort of how we think about it. We were detecting more of the really serious people and fewer of the less serious people, but regardless, the amount, we are surging in every way, shape, or form, and that means the risk right now is much higher than it was even a month ago, right? A group of 10 people right now, randomly selected in Chicago, 10 people getting together, there is a 1 in 3 chance that someone has active COVID in that group. 1 in 3 chance.
Yeah.
So, you get 50 people together.
This is why we're telling people don't have people over to your house.
Don't have people over, exactly. Like, you have 50 people over, I was looking this morning, it's like an 87%. It's like almost a 9 out of 10 chance, randomly selected, there would be someone with COVID in a group of that size. And so the risk with this amount of COVID is really high. And we need people to get more serious and not less serious about protecting themselves and family.
Okay. Well, here's our last question.
Okay.
Might be left over from Tuesday, because I know you talked about schools on Tuesday.
Yep.
From Robin in Williams, Facebook. Can you explain the science of why it is safer to open schools but to not allow indoor dining?
Oh, sure. So, yeah, we talked a lot about schools on Tuesday. We're going to keep talking about schools, I'm sure, for a long time, which I'm happy to do. So the biggest difference is that in schools, you have an environment where everybody is masking all the time. If you are going to have a school open successfully, very strict mask mandates. And that's what we have seen in our schools that are open here in Chicago, in schools in general. There is an absolute expectation that people are wearing masks. There is also an absolute expectation that there is social distancing, right? And so if you've seen, how this is actually set up, like kids are spaced apart in desks. My nephew is in school, in kindergarten in the greater Chicago area, and they've been going to eat lunch in the parking lot next door, and the kids are each sitting in their own parking space. Like these creative things around, if I have to take my mask off, how do I stay distance? What does this look like? The thing is, in a restaurant, pretty much by definition, people are coming to, we love restaurants because they offer an opportunity for us to socialize with each other, right? That's one of the things, we love the food, but also it's the company that you're with. And so we are not social distancing from the people in our group, for sure, and we have to take our masks off to eat. And so those two things are some of what makes, just by definition, dining in a group more concerning. This doesn't mean there hasn't been a lot of work to make restaurants safer, et cetera, but the bottom line is that there is inherent risk to being in close proximity to somebody without a mask, and especially if there are people getting together in those ways with people who they don't live with, right? There's that concern. So the reason that schools have been shown, somewhat to my surprise, I think, to be not a significant spread within the school setting over and over again, around the world, around the country, is I think that there's been strict adherence to these protocols, first and foremost, and there is something about children, particularly younger children, who there's been in research that there is less spread that seems to be in that group. We're still learning about this, but COVID just behaves differently. If we look at our cases, we look at our severe cases, we look at our deaths, it doesn't mean that it is impossible for children in particular to become seriously ill, because we've seen it. We've even had, a very small number of deaths here in Chicago in children. But overall, children are just not impacted in the same way that adults are. And one of the biggest questions is where you're then sort of providing in-person education, what does that mean for staff? And that's where, we talked on Tuesday, some of these studies about, that childcare was not found, in a childcare center was not found to be an increased risk, at least in the first part of the pandemic, is mostly about these protocols. So it's just, for me, at the end of the day, when people are being serious about COVID, if you're keeping COVID in mind when you are interacting with people, generally it goes very well.
Yeah.
It's when people let their guard down and they think, right now I feel safe, I'm not worried. This is someone I know. This is someone I love. I don't need to wear a mask right now. I don't need to keep my distance. I wouldn't possibly get COVID from somebody that I know and love. That's where we are mostly seeing COVID spread. And it's natural. This is like natural human behavior. But the places where, especially the regulated places that have been serious about doing this, and you can keep a mask, think all the way back to think twice. Can you keep a mask on all the time? Can you keep a 6-foot distance all the time, right? These same things, if you've got the really good hygiene and you've got all of this in place, I think that's why they've been relatively safer environments, honestly, than I think anybody expected that they would be when we were looking at this back over the summer.
All right. That's going to be our final question.
All right.
We're going to move into, we have to regulate our social spaces ourselves. That's one of the key differences.
If anybody has ideas, actually, can I just throw this out there?
Yeah.
If anybody has ideas about how we could better message around this. We've been thinking about ways to sort of incentivize good behavior, sort of model, this idea of how am I protecting Chicago? Here are the things that I'm doing. We're thinking about how to sort of get this out. If anybody actually has ideas or suggestions about that, put them in the chat box. I am interested in ideas from all directions on this.
Calling all creatives.
Calling all creatives, absolutely. Because it's a big challenge, and we want to nobody wants to get through this more than I do. Yeah. And it's a lot more about people making those changes in their lives.
Yeah. And we did get kind of loose with things.
We did.
We did. Especially, we finally made it to summer. You could see people kind of hanging out in their circles, and gathering sizes got a little bigger. We had a number
of months here where things were pretty stable from a COVID perspective, even while there was a lot of surging happening
in other places.
And I think people just, and unfortunately, we were watching a lot of trouble around us for quite a while. Yeah. And when it gets in, it just starts growing quickly. And this is unfortunately what we're seeing. And I think people haven't still quite internalized that this means me, right? I was out in my on my back porch on Halloween night, and I could hear 3 different parties going on. Not big raging parties, but
there were parties.
There were parties, people getting together. And that stresses me out, because that is the activity that keeps us from getting over COVID, as a city, and keeps us from being able to take the, you have to use these big sort of blunt tools sometimes, where we'd much rather be more surgical.
Yeah, and I think there might have been this idea that we were seeing more cases, but among young people. And young people can kind of take it, I think there was perhaps a mentality around, well, it's the young people and they can kind of survive this.
Can we pull the dashboard up here real quick again? Because let's actually look at the age, if you don't mind. I know we're done, but thank you for. The red line are our 18 to 29-year-olds, right? For months, all summer, 18 to 29-year-olds leading the pack and all the way down. Well, look what's happened with this peak here. Our yellow line, which is our 40 to 49-year-olds, is on top now. And basically our yellow, red, and blue lines, which are our 18 to 29-year-olds, 30 to 39-year-olds, and 40 to 49-year-olds, are all sort of equal at the top here. Some of this is, I think, more people are getting tested probably in the 30 and 40-year-old group. But nevertheless, we have seen that age group in terms of where there's a lot of COVID and sort of spread really expand. And more concerning, do you see how every one of these colored lines has gone up dramatically? The risk and the number of cases we're seeing for COVID has more than doubled, including in people over 70 and over 80, and even in the kids. And that is how, this is a community, this is a sort of full-on community spread. All age groups, all race ethnicities. male, female, across the whole city. We are seeing, more than 50 new cases in every single zip code across Chicago last week. Like, this is a widespread outbreak.
It's not just the 20-year-olds.
It is not just the 20-year-olds. And my worry is that as, if you've got people in their 40s, if they're interacting with their parents, we're starting to really get into a lot of the very highest risk people in terms of the severe COVID outcomes. So sorry to turn back to the data, but I felt like I wanted to just pull one more thing up.
I opened the door.
I know.
Okay. Just clearing my throat. Any good news?
So let's see. Good news. We have a press conference today at 1 p.m. And there actually will be some good news in there around some of the economic supports and things that we're trying to really do. We're doing so much on the response side, honestly, whether it's about testing, whether it's about response capacity, whether it's really trying to kind of support people who have needs. So I encourage you to tune in at 1 for that. Other than that, just the travel order, we didn't make any changes to it this week in the context of the election and lots of other things going on. Early next week, we're going to be doing a more full update, talking just as COVID has been surging across the country. Some different updates and some different information there, so more to come about that. And just one more plug to the person who asked about masks protecting from flu. Thank you for thinking about flu, because your flu vaccine, we have a vaccine. You get a flu vaccine, it helps protect you, your family, our hospital system, and sort of the rest of Chicago. So it's not too late. Please get one now.
This is the year to get
This
your
is
flu
the year
shot.
to get your flu shot. Chai.gov/flu. Everybody over the age of 6 months, with very few exceptions, needs one every year. Even if you haven't gotten one in decades, get one this year. They're available for free. The health department's running free clinics this weekend. You can get it through your pharmacy, get it through your doctor. So, I think that is it for positive news.
I will add,
yes.
On the 2nd, we opened our rental assistance program again.
Good.
So you can Google rental assistance DFSS or rental assistance Chicago. Applications are being received through November 15th. So if you have found yourself in a circumstance where you really need some support to make your rent, support can last up to 6 months, and we're just really happy to be able to offer that as well. So It's a lottery system. So just get your applications in by the 15th to be eligible.
Good, thanks. Tune in at 1 if you want to learn some more about sort of the city response. I'll be talking just a little bit again about the data. But thank you for joining us. And please make sure in the conversations you're having about COVID that you are spreading the truth about COVID. If you can do that with your friends and your family, that is very helpful where we think about really being able to control this disease.
That's right. Think twice and be safe.
Yeah, be safe, Chicago. We'll see you next week.